We've all had a red eye at some point, right? It's usually just a little irritation, nothing to worry about. But what if it wasn't? What if that red eye was actually a critical clue your body was trying to send you? Well, let's get right into it, because sometimes a simple red eye can be the very tip of a much, much larger iceberg. We're going to explore a really fascinating case where a recurring problem turned out to be a huge medical mystery. This story isn't just about an eye that's red and sore. Nope, it's really about how one little symptom, something you might just ignore, can be the key to unlocking a serious body-wide condition that needs attention fast. So let's set the stage. Our story kicks off with a patient and a symptom that just would not go away. Here are the basics. We've got a 53-year-old woman. Her left eye is red. It's watery. It's just plain uncomfortable. The diagnosis seems pretty straightforward: episcleritis. But, and this is the detail that changes everything, it kept coming back. We're talking 5 times in a single year. That's not just bad luck. That's a pattern. And it was a huge red flag that something else was going on. Okay, before we get ahead of ourselves, we really need to understand what this initial diagnosis even means. So, what exactly is episcleritis? Think of your eye in layers. You've got the sclera, which is the tough white part. Right on top of that is this super thin layer packed with blood vessels called the episclera. When those vessels get inflamed, boom, you've got episcleritis. And this is a great way to see what we're talking about. See that? You've got the transparent conjunctiva on the very outside, then this thin episclera right underneath, and then the thick white sclera. It's the inflammation right there, in that middle layer, that causes all the redness. Now here's what it actually looks like in a real eye. And what's interesting here is the kind of red it is. See how it's sort of a salmon pink color? And the little blood vessels are on the surface, kind of spreading out from the center. This is a classic look for episcleritis. So here's the thing you have to know. For most people, most of the time, episcleritis is really no big deal. Yeah, it's annoying for sure, but it's benign. It almost always goes away on its own in a week or two without leaving any damage. And that's what makes our patient's case so strange. And this, my friends, is where the story takes a turn. Because for this woman, the simple diagnosis of episcleritis, it just wasn't the whole picture. That recurring red eye was pointing to something much deeper. It turns out her red eye wasn't just an eye problem at all. It was the very first sign of a rare autoimmune disease called granulomatosis with polyangiitis, or GPA for short. This is a serious condition where your own immune system starts attacking your blood vessels. It can damage organs all over your body, like your lungs and kidneys, and if you don't treat it, it can be life-threatening. And this is exactly why this case is so important to talk about. The researchers who documented it put it perfectly. Sometimes the eye is the first place a big systemic disease decides to show up. It's an absolutely essential clue that can lead doctors to an early diagnosis, and that can change everything. So this whole situation forces us to ask a really critical question. How in the world do you tell the difference between this common, mostly harmless episcleritis and its much more serious cousin, scleritis, which is often linked to these big systemic diseases and can actually threaten your vision? All right, let's put on our detective hats. What are the key signs a doctor looks for to figure out which one they're dealing with? The number one clue, and it's a big one, is pain. With episcleritis, it's more like a nagging discomfort, maybe some irritation or burning. But with scleritis, the pain is on a whole different level. It's described as a deep, boring pain, like something is drilling into your eye. It can spread to your face, and it's often bad enough to wake you up from a sound sleep. Plus, the eyeball itself will be super tender to even a light touch. You can literally see the difference too. Look here. On the left, you've got that surface-level salmon pink of episcleritis, but on the right, that's scleritis. Notice how it's a much deeper, almost purplish red color? That's because the inflammation isn't on the surface anymore. It's in the deep vessels of the sclera itself. Now, here's a really clever clinical trick. A doctor can put a drop of phenylephrine in the eye, which is a chemical that constricts blood vessels. If it's episcleritis, those superficial vessels will clamp down and blanch, meaning they turn white. But in scleritis, those deeper, angry vessels, they don't respond. It's a simple, elegant test that gives a massive clue. And knowing the difference isn't just an academic exercise. It completely changes the game plan for treatment and the entire outlook for the patient. Just look at this contrast. It is night and day.
For episcleritis, the goal is just to make you comfortable. Maybe some artificial tears, some anti-inflammatory drops. But for scleritis, the goal is way bigger. You have to control that underlying systemic disease to save their vision. That means pulling out the big guns, oral steroids, powerful immunosuppressive drugs. And this really sums up the stakes, doesn't it? Episcleritis can come back, but it's not dangerous. Scleritis, on the other hand, can cause devastating complications, even vision loss, if that underlying disease isn't brought under control. So let's get back to our patient. Once she got the right diagnosis, GPA, the doctors hit it hard with systemic therapy. And check this out. This chart shows her levels of something called C-ANCA, the specific antibody that was causing all the trouble. Look at that. Her levels plummeted from 175 all the way down to 18 in just 3 months. That's proof the treatment was working. And the end result? It's exactly what you hope for. Her systemic disease went into complete remission. The red eye finally cleared up for good, but more importantly, the dangerous condition threatening her organs was stopped in its tracks, all because her doctors looked past a simple red eye and kept asking why. So what's the big takeaway from all this? Look, a red eye is usually just a red eye, but if it keeps coming back or if it comes with that deep, severe pain we talked about, it's a signal you absolutely should not ignore. This case is just an amazing reminder that our bodies send us clues all the time, and sometimes the smallest symptom can point to something really big. So listen to what your body is trying to tell you. It could make all the difference.